The next speaker is Dr. Laura Greiner. Dr. Laura Greiner is the Director of Nutrition at Carthage Innovative Swine Solutions from Illinois, USA. So Dr. Greiner received her PhD in animal nutrition from Iowa State, and her master's and PhD work focused on natural alternatives to antibiotics and the modulation of immune system, nutritional modulation of immune system. And after her PhD, she worked as a postdoc at University of Iowa, doing a lot of microbiological work. Then Laura joined Carthage Vet Services for the last 10.5 years. She was the director of research at Carthage, and she was looking at both basic science and product validations in all aspects of swine growth and development. So today, she continues to serve as an advisor to the research company and is the director of Carthage Veterinary Solutions. Well, I welcome Dr. Laura Greiner.
Thank you for the introduction, Raj. It is a pleasure to be here in Quebec City. I have never been here before. Toronto and Guelph have been my visits to Canada, so it is an honor to be here, and it is a beautiful city. Today I will be visiting with you all about nutrition management and challenges that we see in the swine industry as we start talking about antibiotic-free programs. So as I mentioned, the goal today will be to focus on those programs and talk about how we're going to maintain good growth and reproduction performance, and more importantly, animal welfare, while using antibiotic-free programs. To give you a little bit of background about our company's experience, I work with 10 to 12 veterinarians on a daily basis. However, our focus with the veterinary team is really to minimize antibiotic use. And so we focus a lot on individual animal treatments and less on feed-grade antibiotics. And so over the years, we have pursued many options nutritionally that can minimize health impacts and disease, but we still do use some antibiotics, of course, depending on the conditions of the animal. So in the past, when we think about antibiotics, there are three categories that we reflect on. Of course, treatment and management of disease will be the first. Secondly, we'll be thinking of using antibiotics to prevent disease when we can predict it. And finally, improving feed efficiency. And as most of you know, in the United States today, as of January, this is no longer an option for a variety of our antibiotics. There is still a small classification, such as ionophores, that we can use. But in the interest of this talk, I'm going to classify ionophores as an antibiotic, and so we will not be discussing the use of ionophores as an antibiotic-free option. So obviously, the concern of antibiotics has evolved over 20 years with the, as Lance indicated as well, the concern of cross-species antibiotic resistance between humans and livestock, and in particular using the same medications in both species, of course, has contributed to that concern. In addition, we have consumer groups, probably in the last 5 years, that have been more vocal about their demands and their interests in what they want to be consuming. And those antibiotic-free programs are driven by either a personal health belief, they believe the animal will taste better if it's antibiotic-free, or they think the quality of the meat will be better, or they may be concerned about the environment and any metabolites or antibiotics that are placed into the environment through the manure. So of course, we still want to consider, even in antibiotic-free programs, there will be times where antibiotics will have to be used on a limited case-by-case basis. So before I really started thinking about how to put the topic and the presentation together, my first question was, define antibiotic-free. And there are many definitions in the US as to what antibiotic-free is. In Canada, the CFIA website will tell you that it is an animal that is raised without antibiotics from birth to harvest, and no antibiotics to the mother of the animal that will result in antibiotic residue. This also includes vitamins and minerals, that they can only be given at a physiological level and not for antimicrobial effect. In the United States, the definition of antibiotic-free is slightly different. I went to the Purdue website And I thought this was interesting on their poultry website as to the various definitions of antibiotic use. And I would agree today, in the United States, there is not one set definition of an antibiotic-free animal. And it is driven today by our packers. So what our harvest companies will prefer is what's going to drive the decision as to what program we're going to follow. So in the swine industry today, there is the Never Ever program. And then there will be what we would consider the treatment and therapeutic use only group. And the animals that are in fact treated with antibiotics will of course go to a secondary market. But as you can see, there continue to be additional definitions of how much antibiotics will be used. So what does this cost us? If we're going to talk about ABF, what's the cost? So that we know what kind of return on investment we're going to need to shoot for. So Dr. Main at Iowa State demonstrated in some studies that he had conducted that we would believe that the cost on average is going to be $11 US per pig and could go as high as $15.50 if we figure 70% of the pigs in the barn will go as antibiotic free. There is a conflicting study by Kohler in 2008 that demonstrated that there was minimal reductions in wean to finish performance without the use of antibiotics and animal proteins. And with the opportunity to capture an ABF premium from a packer, the producer would only see an increase in production costs of about 32 cents per head. So who's right? The answer is we don't know. It's going to be very dependent on your system, on the challenges that you're handling and dealing with, as well as what you're going to be able to receive from your packer at the end of the day. I can tell you today from the experience that we've seen in our own research facilities, the difference between using an antibiotic for the first 3 weeks after weaning versus not has been about 1 to 1.5 kilos at the end of 42 days in the nursery. That's a significant difference that we have to make up because we assume that 1.5 kilos will double by the time the pig goes to market. So we're talking 3 kilos of body weight that we're going to have to account for, either through a packer premium or some other method. So how are we going to manage without antibiotics? I have been challenged by our own system to continue, even though we used the first 3 weeks in the nursery with antibiotics, I have been challenged to remove that from our system. And so I have been spending a lot of time thinking about what does that program look like and how do I take that information and put it into practice. And I thought this was really a nice start. The Pork Board has sponsored some work and it's being conducted at Iowa State with Schweer and patients and a couple of other individuals where they're actually starting to go through the literature and put together all of the antibiotic-free products or studies to help us understand what this looks like. And what they were finding from 1990 to 2016, 773 papers were published with almost 1,700 studies in those papers. And in those studies, products that were defined as antibiotic alternatives improved average daily gain only 30% of the time. The other 2/3 of the time, performance was unchanged or declined. What has been interesting in that data set was that in the studies that improved average daily gain, the pigs averaged 24 days of age at weaning, and they were almost 9.7 kilos at the time of weaning. In addition, the studies were very short, 24 days, with very small numbers of pigs per pen. So not very typical for commercial production, where we can see 25 to 300 to 500 pigs in a pen, and we certainly go longer than 24 days from weaning to market. So although the data is good, it's really just a starting point. What they also found were the most effective antibiotic alternatives were probiotics, organic acids, and therapeutic zinc and copper. And so you can see here the relationship in the number of studies that showed a positive response to each of those. In addition, 1/3 of the studies that used probiotics improved average daily gain, and of those, a third used a strain of lactobacillus. So they're going to continue to do some more data mining on the literature, but one of the challenges that we see in the literature is the background of the animal is not very well defined. We don't always know the health status. Are they PRRS positive? Are they negative? Do they have an E. coli issue? Do they not? You know, is this a challenge that's being directly inflicted on the animal, or is this something where the animals are placed into the barn and naturally exposed to an organism as well? So all of those things are going to interplay with how we interpret the data, and more importantly, how we choose to use it in our own production settings. When we think about ABF, I'm going to, of course, focus on nutrition today, but there are other practices that have to be interplayed into the program besides nutrition. Those are going to be health programs, management, and genetics as well. I'm not going to spend a large amount of time, but when we think about health programs, we need to continually ask ourselves what vaccines do we have and what new vaccine technology is coming. So today we vaccinate our sows for various pathogens such as lepto and parvo prior to farrowing, as well as E. coli and Clostridium. The piglets are receiving PCV2 vaccines, flu vaccines, Mycoplasma hypopneumonia, as well as Salmonella and Lawsonia and erysipelas vaccines. So we have a large amount of vaccines available to us, but the ones that we're still missing, such as PRRS and even influenza, are very economically impactful. And those are the ones that we have to continue to challenge our veterinary industry on coming up with new technology, integrating from the human side into the livestock side to drive that program. Management, of course, will be at the barn level. Are your managers able to identify the animals that are sick and get them over to another population? Can they manage ventilation, clean facilities, strong biosecurity? All of those, of course, will interplay into how effective your antibiotic programs are going to be. And certainly today, as we talk genetics, we know there is a certain genetic company that has identified a PRRS-resistant pig. And so some of those questions on will those genetics be accepted in the industry as being an acceptable animal for human consumption or not? And how do those continue to play into the ABF program? So as I mentioned today, I'm going to focus on the nutrition programs. And what I'm going to do is I'm going to go through a series of categories, and I will show data from others on certain products. I am not endorsing a product, but these are studies that I felt were valid studies that had good examples of some of the ideas that I'm trying to demonstrate today. First of all, when I think of ABF, it's critical to think about the phase of growth that you're trying to identify. Certainly we can think sows and wean to finish, but more importantly for me, it's looking at the newly weaned pig. As I mentioned, that's the area where it seems the antibiotics are used most frequently. He is our most susceptible phase of growth, and so it is important to think about that animal a little differently than maybe our sow. But where we can't stop is we can't think about just that pig. We may be needing to use products in the sow farm to be more beneficial to help stimulate that pig after it's weaned. So when we think about the physiology of a weaned pig, he is, of course, going through dramatic changes, going from liquid feed to dry feed. But even in the literature, even if you're going to just liquid feeding, which I know is used in Canada quite a bit, there is still a physiological change of the gut that occurs, whether the animal is going liquid feed to dry or liquid feed to liquid feed. And so we need to focus on those first 3 weeks after weaning to transition the pig, not only for the gut, but because the immune system is also starting to transition away from maternal antibodies. So in 2001, this study looked at using milk replacer or using diets with different levels of lactose and protein ratios. And what they found was regardless of the diet that was presented to the pig, low feed intake, just as Lance suggested, influences gut changes. And that, of course, is going to change the intestinal barrier function, which we now know could take up to 400 grams of glucose a day. That is something that we know a newly weaned pig is not consuming. But we also see that there is an immunological reduction in CD4 and CD8s in the gut. So all of this is occurring regardless of what we do to the animal in terms of feed type. This is a physiological change associated with weaning. In addition to that, as we look at the intestine morphology itself, and we look at the age of the pig in which it is weaned, we find that a pig that is weaned at 15 days of age may have similar digestible function of the gut, but the permeability rate of the gut is higher than that of the pigs that are 18 and 21 days. So again, if we go back to that study that Schweer has done looking at ABF studies, they of course are looking at a 24-day-old pig, which supports this. We do not want to be weaning a 15-day-old pig if we're going to be talking about antibiotic-free programs. We can, but it's certainly going to be a greater challenge to us nutritionally because of that permeability rate. What was also interesting in the study was that weaning age didn't change the mucosal morphology, but just like in the heat stress models, we see that the 15-day-old pig has increased mucosal inflammation. But more importantly, just as Lance mentioned, we're seeing a change in the HPA stress axis. And so a young pig is going to have a chronic activation of this HPA stress axis, which is going to then, of course, change the way the animal partitions fat and protein long term. And so we're going to continually have that challenge of an immune-activated animal if it's weaned too young. So based on that information, we need to think about diets that are going to aid in reducing the inflammation, improve the mucosal morphology, and reduce the opportunity for opportunistic pathogens to become infectious. So when we think about feeding that young pig, approximately 24 hours after the pigs are weaned, 50% of the pigs have consumed feed. But what is still worrisome is after 48 hours, 10% of the population still has not eaten. And how do we identify those populations quickly to try to overcome those reductions in feed intake that are going to continue to degrade the immune mucosal cells? Other things to note is that pigs are estimated to need 3 days after weaning to meet their maintenance requirements and 8 to 14 days to recover their pre-weaning level of energy intake. So Lance did a wonderful job talking about the energy demands of an immune-activated animal. And what we know happens the first 21 days after weaning is the maternal immunity is declining and vaccines are given. And so we have that process going, plus we have leaky gut because of the lack of nutrient intake, so you have an additional immune suppression or immune activation. And yet we're nowhere close to our energy requirements until 2 weeks after the pig is weaned. So you can see how this will continue to build on the animal. And as we start talking about going antibiotic-free, what are going to be our options to put in there to help that animal overcome that significant challenge? It's an enormous quest, an enormous request for that animal to make that difference up. As nutritionists, this is something we've talked about for years. This is easy, right? Young pig, we feed more lactose, we give a little more plasma and fish meal. We know all of these things can be beneficial to the animal, but we can tell you from experience that this isn't enough. And we also know from experience with PEDV that making a program when we wean a pig this young with PEDV isn't enough. We have to go beyond what we know as a nutritionist to start to ask what else can we do. And I pick on PEDV because it's viral. And although antibiotics can help with the secondary infections, nothing is going to help with the initial infection. And so we started looking at different products, electrolytes, glutamate, anything that was simple and easy that could help motivate that animal physiologically to overcome that challenge. So we want to think about all of these dynamics as we go through the next series of slides. And more importantly, what we want to focus on will be improving the immunity and gut enzymes and really focusing on how we can establish the microflora that's desired. The challenge we have is that we don't really know what this is supposed to look like. Microflora interactions are not very well understood, and we know that making a change to microflora could take a month to 2 months before we see the true outcome. We also want to ensure that we're not feeding feedstuffs that allow for gut microflora to overtake the population and cause disease. So when we think about some of the nutritional tools that are available to us today when we talk about antibiotic-free programs, this is a list of the most commonly used products. We can add in there, as I mentioned earlier, ionophores. We can add in therapeutic levels of zinc and copper. We can also look at products that aren't very well established, such as antimicrobial peptides. But today I'm going to focus on these as our primary ones. And then after this, I'm going to talk a little bit about different feedstuffs and how we can use different feedstuffs to manipulate livestock performance. So the first category we're going to talk about will be probiotics. There are two classifications in there. There's the prebiotic, which is really a substrate to feed the favorable species of bacteria in the gut. And then the probiotics, in which we're putting live cultures of organisms into the diet. And generally, when we think about the probiotics, these are the more common species that are used today by the industry. When you're evaluating these probiotics, it's important to make sure that they're stable, that they can survive pelleting, but more importantly, we want to see that it can replicate in the animal and have a competitive exclusion. The data that has come out of the probiotic field has been highly variable, and again, it's because we're putting it in different environments with different health statuses and different diet formulations, and so it's been very hard to understand when is it effective and when is it not effective. The other interesting thing I have noted is that when you talk to different groups, we don't necessarily know if we're giving the desired CFUs needed. There are a lot of probiotics out there, and so if you're going to be working with certain ones, make sure that the companies you're working with have a solid understanding of how many CFUs are in their product and how many are being effective in establishing dominance in the gut. The other thing to consider is you really should be looking for organisms that are derived from pigs. If you're going to be feeding it to a pig, find something that's come from a pig. If I want it to be established in the animal, it needs to be from the original origin, correct? So we see too many products out there where the lactobacillus is something from some other animal or some other area, and yet it's not something that can truly be beneficial to the animal. The other thing to remember is if I'm putting in a foreign probiotic, it might change the microflora in a way that's not beneficial to the animal. We also have to think about probiotics a little differently. And I don't have a slide in here because the data is very new to our system. But we had a sow farm where the piglets were struggling with rotavirus. And rotavirus for us is, there's not a vaccine that's effective for rotavirus C today. And the veterinarians, in dealing with the rotavirus, also were seeing secondary E. coli and Clostridium in those weanling pigs, to the point that pre-wean mortality was 40% in the facility. No PRRS, nothing going on, just enteric challenges of the baby pig. We took a unique approach, and we said we really need to change the sow microflora, because obviously what the sow carries will go to the piglet. And so we placed a probiotic in the system. We waited about 2 months, and as of last week, the system, or that sow farm, is now running 10 to 11% pre-wean. Scours are almost non-existent, and we've been able to overcome that challenge through a probiotic. So while a probiotic can't necessarily fix rotavirus, what it can do is change the flora enough that it makes it no longer an environment in which rotavirus and the secondary pathogens can thrive. So again, think a little bit outside the box, but understand the mechanisms in which you're working with probiotics. Enzymes, of course, have been researched heavily when we talk about feed efficiency. There's nothing new there, particularly when we think about the loss of our feed efficiency claim on our antibiotics. Enzymes are a very effective way to do that. Obviously, though, you need to understand your enzymes and what you have in your diets for your substrates to be effective. We know that enzymes, we do not get good responses when we use corn and soy diets, and we're going to release more energy from our fibrous plant material. Obviously, as I just mentioned, we want to focus on the right enzyme for the right substrate. And there is a lot of discussion on using combinations of different enzymes in a pack, but unfortunately the data, again, is not consistent. So if we're critical of our industry, that's an area that I would be critical of. We need to do a better job, if we're going to talk about antibiotic-free programs and antibiotic-free alternatives, is to get a better understanding of these products. This is not going to be a one-size-fits-all program as we go through. And so we have to have a very solid understanding of all of this information to decide what's going to work for each different system or each different farm. So this was an example of using an enzyme as an antibiotic alternative for feed efficiency and carcass modification. In addition, in the US, we're losing ractopamine. We're seeing more and more packers asking for it to be removed from the feed. And so we have producers that are continually questioning us today on what can we do to try to capture some of that loss back. So this was an interesting study where, as we see the xylanase increase in the feed, we are able to pick up some carcass efficiency up to a certain level before it plateaus off. In addition to the feed efficiency aspect of an enzyme, we're also seeing some discussion around enzymes focused on gut health and pig mortality. And so in a recent study, this was done with the Hanover group that was released in 2016, Kate and Dean reported here that pig viability was reduced from 3.99% to 2.39%, and that is in late finishing. So if we look at that data here, we can see that that mortality declined, again, to about the 0.15 grams of xylanase per kilo of feed. So a very good opportunity for an enzyme or a product to not only replace an antibiotic in terms of feed efficiency, but also help with mortality. Another enzyme that we talk a lot about or heard a lot about is superdosing phytase. And I don't think this is anything new to anyone, but what we do see is that we start to go to more vegan-based nursery programs with maybe lactose as our only animal source. Using products such as superdosing phytase have helped with reducing scours associated with those higher plant products. We've been able to demonstrate that in our own facility a couple of times, and when PED came through our system, this was one of the first things we did was we removed our animal sources from our nursery programs, increased the phytase level, and moved right through the PED issues without any additional concern of triggering E. coli scour or anything of that nature with higher levels of plant product. As I showed with the xylanase, there are ways to modify the carcass of the animal. I'm not going to spend time on this today, but the literature is very strong with chromium. Certainly betaine is being considered, carnitine and CLA. And we are starting to see companies today come out with products that are considered paline alternatives. And although they are not getting the degree of response in terms of feed efficiency and average daily gain, they are able to pick up noticeable differences in both, as well as improvements in yield. So we know that products are out there today, and they might be combinations thereof, but they can be used as substitutes for some of our products that we do rely on today. When we think of baby pigs, this is probably the biggest one most of us think about in our nursery diets, is using an acidifier. Certainly there are a variety of options available. The response of using mixed acids is generally better than a single acid, just due to the activity in the different parts of the intestine, again, to try to help with intestinal overgrowth and some of those challenges. We know that acidifiers are helping with reducing pH. They also improve pancreatic secretions that will help with nutrient digestibility, and also we understand that it inhibits growth of microbes. We know this responses are greater when we're feeding simple diets. So again, if you have a producer that's going to go vegan-based versus complex diets or diets using milk, we would expect to see a greater response with the acidifier in those programs. But what we do know is that the response with acidifiers declines as the pig gets older. And so as we look here with the data from Pettigrew in 2008, our greatest response is a 12% improvement the first 2 weeks after weaning, with a steady decline through finishing. Now, what I do find interesting, though, is in finishing, this is still a 3% response to acidifiers. Well, today our ionophore response is 2%. So an acidifier could still be considered a viable option if we're not going to use an ionophore in finishing. So it's something to think about. While we think that this is not worth doing, if we put it into perspective of some of our other options, it's just as comparable. But again, to demonstrate, what we do see is that over time, if we look at acidifiers, we don't always get a consistent response. And so here Kansas State did 3 studies with the same acidifiers, and what they found is in one of the 3 studies, the acidifier had a positive response, and the other 2 had no response. So again, as I reiterated before, identifying why the products work some of the time and not all of the time is going to be critical as we go through this antibiotic-free program, and as we go through this process of how are we going to design these programs for our producers. The last area that we'll focus on, of course, will be phytogenics. And phytogenics will consist of herbs, essential oils, and oleoresins. The 2 most common that we hear in the swine industry will be oregano and thyme. And phytogenics have a wide variety of physiological impacts. We can look here. It'll increase feed intake, improve gut function through various activities on bile and mucus. They, of course, have antioxidant properties and then the antimicrobial properties as well. We've used oregano in our system multiple times, particularly in our sow herds, again, trying to control Clostridium breaks in the piglets by putting oregano in the sow diets to pre-establish and adjust the microflora shedding that occurs in the feces. It can be successful. I can tell you, though, from experience, we had a farm where we would try a product every 2 weeks or every month, and the product would work for 2 weeks and then start to fail. What we did find, though, unfortunately, in that farm was that we were dealing with Clostridium, and as we started to type out the Clostridium, there were 32 different strains of Clostridium on the farm. Very difficult to say one product is going to resolve all 32 strains. So that's something else you have to keep in mind as we go through these ABF programs. You're going to have to continually adjust because the organisms are going to continually adjust. So this was a nice little study I found from the K-State group where they looked at using the BIOMIN product compared to a negative control, compared to the Neoterra antibiotic program. And this was done in the nursery for 42 days, and I do apologize, this is in pounds. I forgot to convert it to kilos. But what we see here is that the phytogenics, the BIOMIN product, did improve weight gain in the nursery by approximately a kilo, just over a kilo. But we still do see a greater effect with the antibiotic in place compared to the negative control, compared to the phytogenic product. Again, this is nothing surprising. It's something we have seen in our own studies where we are not able to quite overcome the antibiotic program. And as Lance indicated, it's because we really don't know what else the antibiotic program is doing for us to decide what else we need to add to the program to get this to be equal. But this is a nice response that we're seeing here in terms of using a phytogenic product to get us part of the way to overcoming the antibiotic impact. But I also put this one in because, again, I want to reiterate, when we don't know enough about the information, it's hard to say what products are going to work. So here's a study where they used flavomycin and then oregano oil and then an enzyme. And what you can see is that flavomycin gave the greatest response compared to the control, and the rest were either equal or less effective than the control. And I'm not trying to be negative, but again, the challenge is we don't know the composition of this oil. We don't know where it came from or its purity. The enzyme is, again, fairly undefined, as well as the environmental conditions. So as we go through the literature and we think about this, we have to continue to ask ourselves, are we working with products that we feel the data is solid? That we feel that the science is behind the information, or behind the products, so that the information we're going to use will get us the desired response. There are plenty of other gut modifiers. As I mentioned earlier, glutamate is one that we think about. It's a good fuel for the enterocyte in the gut, as well as electrolytes. We've had some very positive results both in healthy pigs and in PEDV challenged pigs. We're using electrolytes, and particularly those infused with amino acids, actually resulted in improved feed efficiency at the time the pigs were 42 days of age. So we know these products have potential to improve gut function as well as reduce the permeability effects of the diseases we're dealing with. And this is just a demonstration. I found this to support the glutamate discussion. The control versus glutamate, you can see the villus height is improved, mucosal thickness is improved, and crypt depth is improved as well. So as we go through all of those options, the products that we can add, the other thing we have to consider are the feedstuffs. What diet ingredients are we going to use and in what phase, and how will that change that gut to, of course, help with feed efficiency and overall immune function. So Dr. Pettigrew has been very active over the last 5 years, 10 years now, looking at different products to use, particularly in early nursery programs, to improve villus length and reducing pathogenic bacteria. And so he, of course, focused some on lactose, which we know is important, but the feedstuffs to me were very interesting. So he did a series of studies where he looked at different products to put in the nursery. So we'll have corn, barley, rolled oats, and rice. And then in the second study, he used 3 different types of rice. And then in the third study, he used different levels of rice. And he looked at the percent of animals that were removed during the nursery study. And what you can see here particularly is that rice and barley have the greatest impact on minimizing pig removals in the nursery period compared to corn and rolled oats. And as we go to higher levels of rice, we see that mortality or that removal rate continue to decline. So again, thinking about our feedstuffs and some of the challenges, and he did a large amount of E. coli challenge work with rice, as well as some other products. And so if you have time, I would encourage you to go through that literature and look at that in more detail if that's something you're focused on today. But rice is certainly going to be a good option, as well as barley. But what experiment 2 demonstrates is that not all rice is the same. And so you're going to, again, face that challenge as you're formulating and thinking about your program, you know, one source versus another, and how do we price it? How do we give it economic merit? And how much merit do I give it? If I know it can reduce pig removals by 1%, what's that worth to me? And more importantly, how do you define it? How do you differentiate? How are you going to evaluate that source versus another source? Do you have producers willing to be your test subjects, or do you need to have a facility that you can go and evaluate that directly? But all of this will be critical, but again, I think this is a nice start to help us understand that we may have to change the ingredients that we're using in our formulations just to help with the ABF program. In addition to that, if we think about the swine dysentery work in Australia, what they found was that they were able to reduce colonizations when they fed highly digestible cooked rice and animal proteins. And what they found as well was that pigs with higher levels of non-starch polysaccharides and resistant starches had greater clinical signs of swine dysentery. So you may even be faced with the challenge as you're going through your programs where you have a producer that struggles with ileitis in the finishing. And maybe for a period of 1 month, you have to use a rice in your diet. And rice, at least for us, is not as economical as corn. And so we wouldn't use rice throughout our finishing period, but we might have to specialize our program for our producer where rice is added for a month to overcome a potential health challenge. So again, your programs are going to have to be unique in the way you're thinking about them and the challenges that you're addressing. One other thing we have to think about is some of the feedstuffs that we're focusing on, we may be able to overcome the challenges associated with them by using other products. So as I mentioned earlier, using superdosing phytase when we're using high plant proteins in the nursery is one option. This was another study that we conducted that actually had a very nice demonstration as well. In the nursery, we used low soybean meal levels versus high. And we used a protease. In this case, the protease was from Novus. But what we see here is that the low soybean meal pigs on the average daily gain perform similarly. But when we start looking at morbidity and mortality, although this wasn't statistically significant, numerically there's definitely a difference. So my high soybean meal pigs had a higher morbidity and mortality value versus my low. And if I'm a producer and I'm producing 3,000 pigs a week, this starts to add up very quickly. But what we do see, though, is that as we add in enzymes, we do see a numerical reduction in that mortality and morbidity. So again, something a little bit unique in its thinking fits very much like the xylanase in the finishing hog, where we're able to use these enzymes and other products to overcome a challenge and give our producers, again, another option if they choose to go all vegetarian and require to use high soybean meal diets. We also know that at about 6 weeks of age, the maternal antibodies are starting to decline. And so we talk about products like egg antibodies and those things that can be beneficial. And we have seen studies, again, where egg antibodies are effective and others where they are not, as well as spray-dried plasma. Again, spray-dried plasma has probably been studied the most, where we've seen benefits improving immune function and cell junctions. So you're going to have that challenge. Some of us today, if we're vegan, can't use plasma. So what are you going to use as a substitute? I haven't seen today much egg antibody data that suggests it can do this, but maybe there's something else in our toolbox that we just need to think a little bit differently on that can do something similar. Sometimes altering the feedstuffs can improve the health of an animal in the face of a health challenge. One of the examples I pulled here is isoflavones. And we know for years that isoflavones have many beneficial effects in humans. We talk about soy consumption and estrogenic effects of soybeans and tofu. And part of my master's program was looking at a compound in the soybean called isoflavones. And what we actually found is that when we fed isoflavones to the pigs in the nursery prior to a PRRS challenge, and then we gave the PRRS challenge, we actually improved the growth rate and we reduced the amount of PRRS virus present in the animal. So we know that there are potential immune modulators even in our current feedstuffs today. But how do we take advantage of them? Because the genistein levels that we needed at 400 parts per million to establish that is not readily available in all soybean gene lines today. But this was a nice example where we can see dietary modifiers even in our current feedstuffs. But again, we're faced with that challenge. If I'm going to add higher soybean meal, as I just showed in the previous slides, we could potentially have an increase in morbidity and mortality in a nursery pig. But yet, I could also be overcoming a PRRS challenge. So finding the balance, maybe adding in an enzyme, maybe adding in something else to try to minimize the potential negative effect, to try to gain the positive effect, is what you're going to have to be thinking through. There's also been some additional work. 2015, there was some work showing a 29% inclusion of soybean meal in the nursery improved the growth of nursery pigs in a PRRS infection. So we are starting to see some of our newer soybean meal varieties at a fairly reasonable inclusion level having some positive outcomes on viral infections. And again, this was one in 2016 that did the same thing. It was 30%, but again, it can reduce medication costs. So we are starting to see newer data come out that would support that the varieties have changed, the isoflavone levels are increasing, and the positive outcomes are there. We might also have to think about a different way of presenting a product. So instead of standard soybean meal, maybe it's fermented soybean meal. And fermented soybean meal in the nursery has reduced fecal shedding of pathogens and has been shown to maintain growth. And from personal experience, we had a group where we were using fermented soybean meal. We thought the cost was too high. We took it out. And within a month, we put it back in. So our producer reminded us very quickly why it was important. So definitely want to be thinking about that when you have a group of pigs that are challenged, particularly with E. coli or another enteric pathogen at weaning. I thought this was an interesting study when we look at different methods to control Salmonella. And we have here an anti-Salmonella bacteriophage, a lactobacillus product, an organic acid, fermented soybean meal, and then CTC. And what we can see compared to the control, our greatest response is actually with the organic acids. And then, of course, our CTC and our fermented soybean meal are very close, even compared to an anti-Salmonella bacteriophage. So again, there's very good data that shows that some of our antibiotic alternatives have great potential and can be comparable to our antibiotic programs to date. We just have to understand better how to use them and to get those responses on a consistent basis. Finally, in here, fermented liquid feeding. For those of you that are using liquid feeding, it is a good step for ABF programs. We see that in the gut there's an increase in lactobacillus organisms, which again we associate with better gut health and performance. And so liquid feeding certainly does have that potential to be a good attribute for an ABF type program. So in summary, I know I've gone through a series of products and feedstuffs today, and I've gone through them in a fairly quick method. But what we do know is that various practices and modifications can be made to minimize pathogenic challenges when implementing an ABF program. We have a wide variety of options available to us. The key is to understand the challenges associated with the system based on type and age of the pig and make that diet work for the animal. It will no longer be a one-size-fits-all, as we put here. We will not be asking the animal to adjust to our diet. We will have to adjust our diet specifically to the animal and to the challenges that they face. And we know that that will continue to evolve just as the organisms evolve on a daily basis. We know that the programs that we put in place can have significant improvement on pig performance. And there are ingredients other than antibiotics that can be added to control and mitigate potential disease and provide positive outcomes. But in reality, in order to be effective, we have to communicate with our farmer and the veterinarian to further understand the health status of the pig and identify times during the piglet's growth phase where interventions are going to be needed. And that communication is going to have to occur on a regular basis. If I have a farm that overbreeds and my pig wean age drops from 21 days to 17, I'm going to have to change my program. Much like I'm going to have to change my program if E. coli becomes an issue or something else becomes a new challenge. So with that, I want to thank you for your attention. I do want to thank BIOMIN for the invitation, and I wish you all a pleasant rest of your conference. Thank you.